Welcome, everyone, to the 17th edition of As the Virus Turns, brought to you by the Alzheimer's Association. This week, we're focusing on the Alzheimer's disease continuum. In the preclinical phase, there are measurable brain changes, but no symptoms. People with MCI, or mild cognitive impairment, have subtle cognitive changes that don't interfere with everyday activities. The Alzheimer's disease phase is broken down to 3 stages: from mild, where symptoms interfere with everyday activities, to severe, where individuals need help with ADLs and are likely to need round-the-clock care. How long individuals spend in each part varies and is influenced by age, genetics, biological sex, and other factors. To learn more, go to alz.org/facts. I'm Doug Pace, and I'm here with Marty Moore. Marty, with the Delta variant being as contagious as it is, how can we address vaccine hesitancy?
You're so spot on, Doug, in that Delta is rapidly knocking on everybody's door. And what we know is, and certainly what the media has been saying is this is now rapidly becoming a pandemic of the unvaccinated. And that's what we're seeing in hospitalizations by and large. Now, the California Coronavirus Testing Task Force, in collaboration with Kaiser Permanente and California Department of Public Health, has put together a pretty remarkable study, and it's looking at human-centered recommendations for increasing vaccine uptake. Now, there's some key messages that they've been able to ascertain through this research, and they're really looking at why is it that people make the decisions that they make. Are there cultural values that influence them? What are the lenses, the world lenses that they look through? And then how is it that we can understand that better and adapt messaging to be more effective? That lends itself then to the 7 archetypes that they were able to determine in how people were looking at vaccination. And then out of that, they have developed 5 categories of recommendations with some incredible examples of messaging. And, when I looked at this, I went, I have given that message before. Now, the conceptual foundation that they've developed is, and really looking at what drives vaccination attitudes and behaviors, is one around the psychology of risk. How do people assess the risk of COVID-19 and then make decisions about it? And to be honest with you, as I was reading through their research, some of the methodologies that people are making decisions, I was a bit surprised by. And I don't know that we've talked about that much. And additionally, they've looked at cultural logic about how do cultural values and world kind of views come into play and influence. And then that lends itself then into the 7 behavioral archetypes that really kind of came out of their body of research in the study. And they believe that the right messaging and value alignment can shift mindsets. Now, what are those archetypes? Well, I kind of looked at it and went, I see myself in these people. And so there's the steadfast opponent, there's the healthy independent, there's the concerned skeptic, there's the indifferent individual, and there's the cautious supporter, and there's the reluctant vaxxer, and there's the vaccine advocate. And so when you think about this and you look at it, you have to then draw in, well, what are those mindsets and attitudes? And this is part of the research that they've given as well. And they've really looked at kind of understanding better, let's say, the steadfast opponent. And I know this is kind of hard to see, but it gives you kind of this world understanding and this psychological understanding so that then you can develop strategic tactics and how to engage. Now, one of the things is through those recommendations, they're guiding you in this body of research of how to understand, how to respond. And what's really critical also is messaging. So if you think about messaging, and this is when I said, I looked at this and went, oh, wait a second, I've said this, the vaccine does not change your DNA, and in many times when we've said that, I went, of course, it doesn't change your DNA. Well, that isn't what people heard. And so it's really kind of changing that no corners were cut, only red tape. And so let's talk about that. And do you know? And really kind of how to bring that messaging forward. And so this report gives you almost this roadmap of how to re-engage maybe your employees and the people that you're working alongside. And I want to stress it again, Doug, the window is narrow. Delta is a ferocious opponent, and we really have to re-up ourselves around vaccination.
Well, Marty, it really does look like a great report. If our listeners want to read the full report, how do they obtain the copy of it?
I would be happy to share with them. I have the full PDF and I'll send it to them. So get your pen and paper ready. My email is Oregon, O-R-E-G, oh, wait a minute, G-O-N. I know how to spell Oregon, O-R-E-G-O-N, and MLM, Mike likes Mike, at iCloud.com. Again, that's Oregon, MLM at iCloud.com.
Well, Marty, thank you so much for your willingness to share this report. And thanks to all of you for joining today. Have a great week, and we'll see you here next week for a new edition of As the Virus Turns.